You're 8 months pregnant. It's 2 a.m. Your head feels like it's splitting in half. You reach for the Tylenol bottle your doctor said was safe. Then you freeze. For decades, every doctor, every pregnancy book, every medical website has said the same thing. Tylenol is the safest pain reliever during pregnancy. It's been the gold standard recommendation for over 50 years. But suddenly, millions of women started throwing away their medicine bottles, terrified they might harm their babies. Here's what actually happened. In 2023, federal courts threw out over 500 Tylenol autism lawsuits. Not because the families didn't deserve compassion, but because the science behind the claims completely fell apart under scrutiny. You're about to see the real data that courts looked at, understand why those viral studies got it wrong, discover what the best research really shows, and learn the truth that could help protect your baby's life. By the end of this video, you'll understand more about this controversy than 99% of people sharing scary stories on Facebook. And you'll know why avoiding Tylenol when you actually need it might be the most dangerous decision you could make. The panic spiral. Let's start with how this fear began. In 2019, a study came out suggesting pregnant women who took Tylenol had children with higher autism rates. The media went absolutely insane. Tylenol linked to autism screamed across headlines. News anchors ran dramatic segments. Social media exploded with terrified mothers sharing horror stories. Overnight, one of medicine's safest pregnancy drugs became public enemy number one. The first big warning sign most people missed is that it wasn't a clinical trial or a genetic study. It was just an observational study. Researchers simply looked at medical records and noticed patterns. This is important to understand. Observational studies can only show a connection, not prove one thing causes another. It's like saying people who carry umbrellas get wet more often. Does that mean umbrellas cause rain? Of course not. They carry umbrellas because they know it's going to rain. The same logic applies here. Maybe women who took Tylenol during pregnancy were dealing with more stress, illness, or genetic factors that actually contribute to autism risk. The Tylenol might just be a coincidence. Real science versus real fear. This changes everything you thought you knew. In 2024, Swedish researchers published a study so massive and so well-designed, it changed everything. They followed 2.5 million children. But the genius part is, they specifically looked at families where the mother took Tylenol in one pregnancy, but not in another. Same mother, same genetics, same environment, same family history. If Tylenol really caused autism, you'd expect the exposed child to show higher autism rates than their sibling. But guess what happened? There was no difference. Zero. The small autism risk found in earlier studies disappeared when researchers looked at brothers and sisters from the same family. This shows that the earlier results were likely due to other factors, like the mother's genetics, her stress, or the health problems that made her take pain medicine in the first place. In another large study from Japan, looked at over 200,000 children and found the same result. When researchers took family genetics and environment into account, there was no clear link between Tylenol and autism. What makes this even more important is what the experts actually recommend. While people on social media were panicking, something surprising happened. The world's top medical experts didn't change their advice at all. The FDA, CDC, World Health Organization, and American College of Obstetricians and Gynecologists all maintained their position. Acetaminophen remains the safest option for treating pain and fever during pregnancy. Why didn't they panic like everyone else? Because they understand something most people don't. Other common pain relievers like ibuprofen and aspirin can cause serious birth complications. Ibuprofen can harm kidney development and reduce amniotic fluid. Aspirin increases bleeding risk. Now, this might surprise you. Untreated high fever during pregnancy is a known risk factor for miscarriage, birth defects, and developmental problems. When you're running a 102-degree fever, your baby is literally cooking inside you. So the medical establishment faced a choice: recommend a medication with zero proven autism risk, or tell pregnant women to suffer through dangerous fevers that could actually harm their babies. The choice was obvious. Why the lawsuits failed in court. In 2023, over 500 families filed lawsuits against Johnson & Johnson and major retailers, claiming Tylenol caused their children's autism and ADHD. These weren't small claims. We're talking about families who hired top-tier lawyers, brought in expert witnesses, and demanded millions in damages. The federal judge spent months reviewing the evidence. Expert witnesses testified. Scientists presented their research. Lawyers made passionate arguments. But then came the plot twist nobody expected. The judge dismissed the whole case, not because the families weren't going through real pain, they were, but because the experts couldn't prove with solid science that Tylenol was the cause. The court said the experts only picked studies that supported their claim, ignored other important data, and used unfair ways to look at the results. In legal terms, their science wasn't strong enough to count as reliable evidence. Some lawyers are still trying to take these cases to state courts, but the pattern is clear. When Tylenol autism claims are carefully checked by science, they don't hold up. The real autism risk factors. While thousands of women have been blaming themselves for taking a single Tylenol, here's what actually drives autism risk. Genetics account for over 80% of autism cases. It's primarily inherited DNA, not environmental factors. Advanced parental age, especially fathers over 40, significantly increases risk. Low birth weight, maternal infections during pregnancy, and exposure to certain toxins also play roles. But Tylenol, it doesn't appear on any official list of confirmed autism risk factors from major medical organizations. Think about this. Autism rates have been climbing for decades, but Tylenol used during pregnancy hasn't dramatically changed. If there was a real connection, we'd expect to see much clearer patterns in the data. Instead, what we see is better autism diagnosis, increased awareness, and expanded diagnostic criteria, explaining most of the apparent increase in cases. Final thoughts. If you've made it this far, you now know more about the Tylenol autism controversy than most doctors have time to explain in a typical appointment. You've seen how observational studies can mislead. You've learned why sibling comparison studies are more reliable. You understand why courts rejected the lawsuit claims. And you know what the world's top medical authorities actually recommend. Tylenol doesn't cause autism. The strongest scientific evidence, reviewed by federal courts and international medical organizations, shows no credible link. Your job as an expectant mother isn't to be perfect, it's to be informed. And now you are. Next time you see a scary headline about pregnancy and medications, remember this video. Check multiple sources, look for replication studies, ask your doctor about the actual evidence, and please share this video with anyone who needs to hear the truth. Fear spreads faster than facts, but facts still matter most. Your baby needs you to make decisions based on science, not social media panic. You've got this.